The Medicare open enrollment period is now. It started yesterday and runs through December 7th. To share more about this period to get federal health insurance, Salentia Slavak joins us with Mitch Anderson from Primetime Health Advisors.
Hello, welcome back. I'm here with Mitch Anderson of Primetime Health Advisors. He's going to try to help guide us through this open enrollment process, especially those that have to choose their Medicare plans. Welcome to the show, Mitch.
Thank you very much.
So briefly, what do you do at Primetime Health Advisors? What is your role there?
We've got an agency, Primetime Health Advisors, and we are specialists in helping people choose plans that work with Medicare, and this is our busy time of the year.
What are some of the common mistakes people make when they're trying to choose their Medicare plans?
Well, there's several common mistakes. The most common mistake would be when people make a choice based on emotion rather than on fact.
Okay.
And when I say emotion, I mean someone might find advice from their brother or their sister saying enroll in this plan, or they might call a number on the TV screen for a TV ad, or respond to a letter in the mail or a postcard. The amount of junk mail that Medicare eligible people get this time of the year is absolutely overwhelming. When I say make a decision based on fact, we want to try and help people reduce their stress as much as possible. And that's different for everybody. And it might be what it always is, making sure that we find the best plan that treats them well at their pharmacy for their prescriptions, making sure that their healthcare team is in network with the plans, making sure it fits within their budget. All of those are things that help people make a really good decision.
Why would someone choose to use, say, your services, as opposed to just making those decisions on their own?
Because it's stressful. It's complicated.
Yeah.
And we want to help people reduce that stress as much as possible. We try really hard to simplify the process, have a good conversation, make good decisions for people, give them good advice.
It sounds like you're pretty passionate about it.
I am. I am. Once again, it's stressful, it's complicated, overly complicated in many cases, and I don't want people to feel like they're alone and have to make these decisions by themselves. We're really passionate about helping people make the right choice, being on their team, giving them good solid advice year in and year out. And we're local. We're right here in town.
That's right. So if someone wants to, contact you about your services, what do you charge?
We ask people to pay exactly $0. We don't charge anybody for our services. The only thing we ask is that they pay attention.
Okay. Well, thank you, Mitch. That really helped. I hope that helped a lot of people out when choosing their health plan, especially with Medicare. Thank you so much.
Thank you.
All right, more details at KTTC.com. Coming up next, we have a new face to introduce you to.